So how are you doing?
I'm good. How about you?
I'm good. I love your TikTok page. I said it to you in the message, but I love that you're advocating for POTS. I love that you're a guy doing it because you just don't see it as much. And so I love it. And kudos to you is all I'm trying to say.
Sure. Yeah. Hi, I'm Connor. I'm the POTS guy on TikTok. Yeah. I'm 29. I'm an occupational therapist in the Boston area. I'm also occupational therapist by trade, but I'm currently director of rehab at a skilled nursing facility just outside of Boston. So that's kind of my jobs. I mean, obviously, POTS I think is 85% women, but I was like, there's some guys on TikTok that definitely have
There's
POTS. I feel like I should step up. So yeah,
You're completely right. There are men who have POTS. It's just not as common as it is for women. And then I think, though, honestly, like long COVID, I feel like it's just going to be one of those things that it's just becoming more and more prevalent and it's just going to be exploding. You're going to see a lot more people across the board just in general having it.
I had COVID in December 2020, and it hit me pretty hard. I mean, I didn't go to the hospital or anything, but I was down for the count for like 2 weeks out of work. Um, and for a few months, I didn't feel quite right, but I wasn't symptomatic or anything. And then like mid 2021 at work, I had what I now know as pre-syncope. I felt like I was going to pass out. Um, and I was like, wow, that's never happened. Went to urgent care. Um, and I have a bad habit of this. I like already had hypothesized what it could have been. Um, so and
I do the
so
same thing.
Yeah, so I'm vegan. So I was like, oh, maybe I'm deficient in B12. I know vegans can be deficient. So the PA there was just like, oh yeah, so yeah, deficiency in B12, I think. So he didn't run any tests or anything. Around then, I also started developing migraines, which I had never had. Pretty much until the end of 2021. I had an occasional pre-syncope and migraine, but I pretty much just thought it was maybe like I was starting to have migraines. Um, but early 2022, it started getting much worse. I started like having to go home from work multiple times a week because I was an occupational therapist at the time, standing 6 or 7 hours a day. And by complete luck, so I think this is very unique, and this is part of why I started the page, because I think I have a bit of a unique position. My girlfriend is, by complete luck, an autonomic neurology physician assistant.
There you
So
go.
she started like, she told me this after the fact, but she said like back when I started having pre-syncope, she was like thinking POTS, but she was like, no, there's no way that my partner has the condition that I'm always seeing patients for. But then as it started getting worse, she did, the poor man POTS test, and it was like very, very clear that based off that, I might have POTS. So luckily, she has a ton of experience. She told me the compression, the salt, increasing hydration, kind of typical POTS triggers. And that helped some for a few months. And then I got to a cardiologist in June of 2022, and he gave me a heart rate monitor just to, I guess, rule some things out. So that was insignificant. There was nothing on there. And another fact about me, I guess, I've always been like a cross country runner. I like playing basketball. And as this was coming on, I would notice that like what felt like, perceived exertion wise, like a very slow, easy run, my heart rate would be like 180, which is like, that's like heart rate for like a sprint, I think,
Yes.
at least for someone my age. And same with basketball. Like there was once or twice I just could not even. I had to like just a casual pickup game. Like I felt like I was like I had to stop basically. And once I felt like I was like having a heart attack, so I know that's now just like palpitations, which are also common, but
Yeah.
um, I got on propranolol after the heart rate or the heart monitor came back insignificant. And propranolol got me like 25% better, I would say. It helped, but I still was not quite right. My girlfriend Sadie calls it like the pot cycle, like standing causes symptoms, so you start avoiding standing, and then that deconditions you and that lowers the threshold for symptoms. And that's unfortunately how people get like bedbound, sadly.
Yeah.
And in October, this past October, I got my formal autonomic testing with her attending physician, who's like one of the top autonomic doctors in the nation. Luckily, it came back positive, like for POTS, positive POTS test. My testing also said I was like hyperventilating, which I didn't even realize. In January, I got put on Mestinon, which is a very good medication, and that got me, I would say, like 90% back to baseline. So that medication, that plus propranolol, is like what works for me. Yeah, you kind of just have to trial different medications, unfortunately. And I guess I just got lucky that I found the right um, combination early on. I'm definitely lucky that pretty much a year and a half ish after my first symptom, like I got diagnosed and like on the medications that are going to help me, because I see all over TikTok that it takes some people like so many years. Like
It's
just
on average, it's 7 years. Is there anything that sticks out in your head like that was a win for me?
Yeah, definitely. Once I got back on Mestinon, or once I got on Mestinon, uh, I felt like my standing heart rate was no longer spiking as much. So I was like, all right, I should definitely try running again. And I remember like I went on like a 10-minute run, which for me, I mean, before a 10-minute run was nothing, but I went on just like a 10-minute run and I felt good. And that was like a huge moment for me, because I felt like I could like get back into running, get back into more athletic things. So that was a big moment for me mentally, to kind of feel like I'm getting back to how I was before POTS.
So I totally understand. And that is a big success being able to do that. So are you able to do any longer runs now, or are you able to continue to get runs in?
I'm at the point I'm running like 20-minute runs.
That's great.
So that's around, and my girlfriend, since I have like someone who is so experienced with POTS, I feel very fortunate that, I mean, she says that that's pretty good for someone with POTS. Like most of her patients um, are not at that point. So I feel very fortunate that everything came together, like as far as me knowing relatively early on that it was POTS and getting treatment, that I realistically didn't really get deconditioned like so many other people did. So I'm happy that, in the grand scheme of things, happy how things turned out. Yeah. Yeah. So like one other video I want to make is like about supine exercises you can do, basically, so that any heart rate increase that's occurring is just from the exercise, not because of the positional change. Because so I think not a lot of people think of that possibility.
I feel like you are like the luckiest man on the planet. I do. Your girlfriend working for the autonomic clinic, being able to help you find that diagnosis so quickly. I mean, I can't, I mean, those are huge wins for a lot of people who have POTS. And so I think you're
Yeah.
a step ahead, and I feel like it'll be okay for you. If you just keep on top of it and you keep managing those symptoms. I know you're on medications now, but have you been able to kind of manage it to where you're able to figure out, like, at work, like, hey, I know I need to sit down for a second, or I need to modify how I'm doing things. Can you just talk about work a little and how you're able to work?
Um, so I was doing occupational therapy 8 hours a day. And I was very fortunate that as symptoms came on, I was given the opportunity to kind of step into a management role, which brought my like treating patients time down to closer to like 2 to 4 hours a day. And then
Mhm.
the rest of the day I could sit if I needed to. And even that 2 to 4 hours was not manageable at points. But yeah, I definitely over time just kind of became used to what were triggers at work, like trying to make sure my office was cool.
Mhm.
Um, what else? Trying to make sure that if if there's no reason for me to be standing, even today, like if there's I try not to like stand bedside. Like if a patient's in bed, I'll just like pull up a chair. Um, so I try to not push it as far as like pushing my limits, not standing hours on end. Like the second I feel symptoms, I know if I lie down and I kind of resolve it before it escalates, that can really just kind of prevent it from happening for me.
Any of the skills that you just have through that, have you been able to apply to yourself and helping you through too?
Yeah, that's a good question. Like the general idea that I try to, because when patients come there, they're coming from the hospital,
Yeah.
and they're not ready to go home. Their spirits are down, and I kind of have to like rally the troops mentally and be like, all right, this is going to be a process, but we can get you home. You just have to like kind of put in the work. So, um, not
Mental
obviously work.
attitude is everything, right?
Yeah, so I kind of tried to have that mentally with me, like especially once I got the diagnosis, like, all right, this is going to be a process, but at some point, I'm sure, I'll be where I want to be. So I kind of tried to always have that light at the end of the tunnel, which, um, again, is easy to have when it's only been a year and a half.
Hmm.
Um, Easier than 7 years, especially for some people.
I mean, you kind of already said it, so I think I know the answer, but who do you feel like is your biggest supporter in just your journey with this in general? Is it your girlfriend? Do you have
Yeah,
family that's huge support?
definitely my girlfriend. She's been support medically, support personally, of course, throughout this whole process. I definitely question whether I would even be able to still be working if it wasn't for her, because I probably wouldn't have been steered in the direction of POTS so quickly.
I'm
Um,
sure.
so I'm really in this good mindset, good physical space. I'd say because of her, 100%. Because um, like you said, I'm just very lucky that I just so happen to have a partner who's directly deals with POTS. So I'm a pretty good advocate for myself. I would say the worst I ever got was like maybe people not understanding what POTS is, and um, I had to educate them. Like definitely at work, definitely some friends who, because I'm sure you've heard like alcohol is for sure a trigger for pot. So I really don't drink anymore. Some friends really haven't understood why, even after education.
How have you had any times where you feel like you need to bring up the illness in a relationship? It could be an employer, it could be a coworker, it could be a friend. And how do you go about that? How do you decide when to tell them, I guess,
Yeah,
or when it's important for them to know?
the first time I really told anyone was I was going to their wedding, and um, it was like early on, and I was definitely going to be sitting most of the time. So I was like, hey, here's what's going on with me medically, and it's going to result in me, unfortunately, not being dancing much at all. I'm going to probably be sitting, and I just wanted you to know that that's because of this medical condition, not because I'm not, you know, happy to be there or something. So I was like, why is he sitting? Why does he seem off or something? I would rather proactively explain what's going on than have to do it in the moment or have them wonder. So it's obviously a case by case basis, but I would definitely just encourage people to
Talk about it.
talk talk about it, be open about it, and yeah, definitely try not to feel like there's a stigma with it. I know that's easier said than done. I would hope they would be understanding, and if they're not, maybe it's time to think about whether that's someone you want to have that closely in your life. I hate to say, because they should be understanding about something you can't control like POTS and how it presents. So yeah, I went to James Madison University down in Virginia. Right now I'm up in Boston. I went to graduate school, got my master's degree in occupational therapy at a little school called Bay Path up here. Um, some of my passions are definitely running, exercising, um, what else? Music. I like rap music especially.
Do you have a quote that you find yourself coming back to over and over? Just something that you heard or read that has stuck in your mind?
Oh, I guess I have a good one. So I have a tattoo of a rose here.
Oh, okay, nice.
And I got that because there's a quote that I like that says, "You can complain because roses have thorns, or rejoice because thorns have roses." So I think that applies to pot some. You can. It's obviously easy to be down about the symptoms you're feeling, um, and about maybe the effect it's having on your life, but you can look at it in a positive light of, there's hundreds of diseases that could be worse that are progressive and terminal. Um, and there's medication management that you can do. There's lifestyle changes that you can do to manage your POTS. So there's always a positive, light to any bad situation. I definitely encourage people to, look within and really see who they are outside of POTS and kind of how they can build off that and help have them use that to help themselves mentally, because POTS takes a mental toll on everyone for sure.
Do you want to talk a little bit about your channel?
I just searched up POTS on TikTok, and um, not that there's anything wrong with this, but most of the top ones were, people showing themselves passing out, and in my opinion, more so highlighting like the downside of POTS, which of course is easy to highlight. It's a very hard illness. I felt like I had a unique position as far as someone with POTS and having someone that close in my life that is a wealth of information on POTS. I want to keep it informative and as positive as possible.
Yeah, and like I said, I love your perspective. I love that you're in the mix, that you're showing that it is possible for men to have POTS. I mean, I encourage it. I love it. You're doing great.
Thank you.
I know that community is close knit, and I think that they'll welcome you in,
Thanks.
for lack of a way of saying it.
Yeah.
Is there anything else that you want me to know, or that you might want others to know about you that we didn't talk about?
I know there's research going on like into post-COVID POTS especially. So I would definitely, in addition to meds and lifestyle changes, just have people, hold out hope that, there's going to be even better treatments in the future for POTS.
And it sounds like you're doing everything right too. You're managing to get the exercise, you've got the medications down, you know what your sodium intake should be. So it sounds like you know what to do, and that sounds like you're doing all the right things. And I'm sure your girlfriend's probably like, you got to do all this, and I'm sure she's kicking your butt when you're not doing the right stuff too.
She was at the beginning, but yeah, like I said, she's a massive part of how I'm at where I am today. So definitely appreciate her input whenever it's given. I appreciate you showing interest in my perspective. Yeah, I definitely hope the video and whatever you release helps someone out there. So yeah, thank you
Yeah.
as well.